So good evening, everyone. So today we are here for the very new episode of our Polaris Talks, and as discussed before, we will be doing general anatomy sections throughout this whole month as such. So and we have been covering a lot of topics so far, whichever we have already covered is there in YouTube. You can just take a look at the previous episodes as well. So today we are here with a section on joint anatomy. And for that, we have Dr. Sanjit Bajpayee, Chief Academic Officer at Dr. Polaris. Hello, sir.
Hi,
Welcome to today's
Aishwarya.
episode.
Yeah, hi.
How are you?
I'm good. How are you? And I believe
I'm
all
also
the
doing
students are
great.
also good.
Yeah. Hoping everybody is doing great.
Yeah,
How are you guys, everyone?
I hope all the students are silent and they're ready.
Yeah. Okay,
Yeah,
let's get into the topic, sir, without wasting much of the time. Over to you,
right.
sir.
Okay. So, good evening to everyone. Good evening, all students present here. Thank you for joining once again to our Polaris Talks, where we are having anatomy discussions and we are covering various aspects of general anatomy from basics till advanced, right? So, we have covered a lot about bone, we have covered a lot about cartilages, right? And we have covered a lot about these kind of segments where histology is concerned. So, we are increasing day by day. So, now we are going into much complex structures. We know what the bone is, we know how the bone is formed. But now, when both bones or two bones join together, what is it going to be? That's what we are going to discuss today. So, what exactly is the joint anatomy? We are going to go thoroughly in and out today. Okay. So, not wasting much of time, what I have done is, in order to understand this topic whole and soulfully, because this is a very important topic, your skeleton is concerned here, we have divided the topic into two segments. So I'm going to take the first part segment today with the aspects of clinical scenarios. And in the second part, we'll be discussing the second part of this joint anatomy, where we'll be solely covering about synovial variety of joints. Okay. So I'm covering a part or the first part of joints today, where I'll introduce two different type of joints, where I'll give you clinical scenarios and I'll tell you how these joints actually function or what is their work inside our body. Okay. Right. So let's start our discussion about joint anatomy. Okay. Now, once we read joint anatomy, what exactly is a joint? A joint is basically nothing. It is a junction between two bones. That is given the name as joint. Now, there are various ways in which we can classify these joints. Okay, this is how we can classify all over our body. There are different varieties of joints. So this is how your questions are going to come. What varieties of joints are found in what areas? Okay, right. So if we take in total, joints can be classified by two important categories. One is according to the function they are doing, and another is according to the structure that they have. These are the two ways in which we can broadly classify joints. Okay, so the first classification of joints is called as functional classification. That means it is upon the mobility of the joints, right? How much they are mobile. Now, according to this, they are classified into three important varieties. Now, remember that whenever you're going to be asked a question in your vivas or your MCQs, every particular person is going to ask you two aspects: classify this joint as per the structure and as well as for the function. So you should know how to classify these joints in both ways. Okay. So three things are in structural classification: mnemonic, SAD. Okay. SAD. Simple ways. S means synarthrosis. Now, syn means together. Wherever we say syn, it is together. Arthrosis means bones. That means two bones which are closely knit together. And once they join together strongly, they cannot move. See, my both hands are joined and they cannot move. This particular junction is given the name as synarthrosis. Now, simply imagine, where in our body will you find this kind of a scenario? Skull. If you see my hands, which are joining like this, like an interlocked fashion, and if you see our skull, these interlocked things are what are forming something called as synarthrosis. And what we give them names as, we call them sutures. Okay. So wherever sutures are present, we give them the name as synarthrosis or immobile joints. These sutures are never mobile. Always remember that. Wherever sutures are present, let's say this is the skull, it is fixed. All the parts are fixed through these sutures which are not mobile. This is called as synarthrosis. Now we come to the second type of functional classification. That means their mobility is there, but they are slightly mobile. Now, how is that slight mobility going to happen? See an example, just like your intervertebral disc. Now, these are your two vertebrae, right? And between the two vertebrae, there is a small disc that is called as intervertebral disc. Now, just imagine your spine, okay? Now, you're going, whenever you walk, you bend back, you bend forwards, you bend on the sides. How is this possible? The spine is working in tandem with two vertebrae and this disc. That is why this appears to have slight mobility. Okay, you cannot go all around 360 with the spine, right? That is why it has got slight mobility. That is why we give them a name as amphiarthrosis. Amphi means in between. That is, it is not completely happening, neither it is incompletely happening. So because it is in between, we give them a name as amphiarthrosis. Example, intervertebral disc. Now comes D. D means diarthrosis. That means freely mobile joints. So any particular joint which is freely mobile, that can be an elbow joint, can be a wrist joint, can be my metacarpal joints, can be my knee joint, hip joint. They are all variety of synovial joints. We are going to see synovial joints in complete category. As a category, we are going to dissect out each and everything what synovial joints are. But just remember, wherever joints become freely mobile, that means suppose they are moving like this and this, they are called as synovial joints. Okay, they are freely mobile and they come under diarthrosis. So functional classification: SAD, SAD, synarthrosis, amphiarthrosis, diarthrosis. Synarthrosis, no mobility in sutures. Amphiarthrosis, a little bit of movement. Intervertebral disc, best example. Diarthrosis means freely they are mobile, they can go into various range of motion. That's what the word is, and they are given the name as synovial joints or they are an example of synovial joints. So this is basically the classification on the basis of function. Now I'm going to go into how can you classify joints on the basis of their structure. Okay, then we are going to see one by one. Right. Now, structurally, your whole joint can be classified again into three types. So I told you three varieties in function, SAD. Three are there in structural. In structural, those three can be remembered by a simple mnemonic CSF. Cerebrospinal fluid we have, right? CSF. C for cartilaginous joints, S for synovial joints, and F for fibrous joints. So CSF are three types of, again, structural classification. That means either they can be fibrous, or they can be cartilaginous, or they can be synovial. This is a structure. But according to, again, function, they are SAD. S, A, and D, what I already told you. Right. Now, I'll move on to each and every particular type of this structural joint. So I told you CS and F. In that, synovial variety of joints is another topic which we are going to discuss in detail. What I'm going to discuss today will be the fibrous joints as well as the cartilaginous joints, what these particular categories are, right? Okay. Now let's move on to the first variety of joints, and this is called as fibrous joints. Now, what do you mean by fibrous? Fibrous means solid. Wherever the word fibrous comes, it is solid. That means whenever there is one particular bone, another particular bone, they are going to form a joint together, but there is not going to be any kind of a cavity or a joint cavity between them. That means one bone like this, one bone like this, joined together, but no cavity in between them. This is a solid joint. That is why we give it a name as fibrous variety of joint. Now, again, fibrous joints are again of three types. Okay, so that's why I'm telling you mnemonics, because there are many terminologies inside them. But if you remember just roughly these mnemonics, you will understand the whole concept well. Okay, under fibrous joints, there are three types of joints. Again, I told you what is one bone and another bone joining together. This is called as functionally as synarthrosis. So similarly, three types of fibrous joints are sutures, syndesmosis, and gomphosis. Now, don't worry. I'm going to show you various pictures of what sutures mean, what syndesmosis means, and what gomphosis means. Just remember that these are three types of fibrous variety of joints under structural classification. Fine? Okay. Now we'll see one by one. So you know two important things in fibrous joints, that they don't have a joint cavity, as well as these are rock solid, right? They don't have any kind of movement in between them. That's what fibrous joints are. So let's see the first part of fibrous joints. Let's come to sutures. Now, what do you What do you mean by suture? Suture means what? Whenever we are putting a suture, when we are stitching, suture has been taken from a very important Greek word which means sutra. And sutra means sewing. When you sew something, that means one structure here, sewed together, it forms a sutra or a suture, right? This is what sutures are. Now, again, sutures under fibrous joints are again of 5 types. Okay, so don't get confused. I'm telling you multiple subheadings, and that is why I've kept synovial separately, so that you don't get confused. Sutures, again, are a type of fibrous joints, which are again having 5 type of varieties. This is on the basis how they actually are present. They can either be plain joints. Plain joint means one bone here, joined together, and in between them, what you see the line, this is my suture. So this is called as plain suture. Let me show you an example of it. See this. This is one bone, this is another bone. They both join together in the center, and this suture that is formed, this is called as plain suture, right? This is first type of particular sutures that comes under fibrous joints. Okay, this is called as a plain suture. Now, what is an example of a plain suture? Example of a plain suture is this particular bone. If you see here, this is nothing but my hard palate. If you just touch your palate, that particular palate, it is made up of a bone. Now, what bone is making the palate? You have these bones here. These bones are called as maxilla. Okay, maxilla. Now, these bones give something like this. They form these projections on both the sides. Now, because they are forming the palate, they are called as palatine processes of maxilla. Simple, because they are forming our palate. So suppose one of our maxilla is here, it is forming one palatine process. One maxilla is here, it is forming one palatine process. They both are joining together in the midline by one suture. This is called as a plain suture, which is a type of fibrous variety of joint. Got the idea? So what is the example? Example is simple. Interpalatine suture is an example of plain joints under suture. Plain sutures under the heading fibrous joints. Right? Okay. Now you know what are plain sutures under the first heading. Example, I already told you, maxillary suture, or basically you can just say it is basically a fusion between palatine bones or interpalatine suture. Simple. Okay. Now we come to the second type of suture, that is serrate. Now here I'll get you two terms, serrate and denticulate. Now what do you mean by serrated? Wherever you get a medical term serrated, serration means zigzag. Okay, so if my bone was like this in plain suture, my bone will now become like a zigzag like this. And one zigzag with another zigzag bone will unite together to form this kind of an arrangement. This is called as a zigzag pattern, or they are simply called as serrations or serrated sutures. Now just simply see these sutures and I'll show you. See this? One bone joining to the other bone by a particular zigzag pattern. This is called as a serrated suture. Now, where do you get this kind of a serrated suture? Just think. Are you seeing this? The skull, right? So if I take the top view of the skull, let's say here, beautiful view, you can see these two serrations, right? Two bones joining together by these serrated sutures. So this particular suture in the skull has been given a name. We call it a sagittal suture, because if you remember, in the beginning part, introductory part, we discussed about planes and we told this is the sagittal plane, right? So in this sagittal plane, if a suture is present in our skull, it is called a sagittal suture. Simple as that. And it is a type of what? It is a type of serrated suture. So two bones, and which two bones are these? These are parietal bones. This is your parietal bone. This is your parietal bone. They're joining together in the center and they are forming something called as what? A serrated suture, which is sagittal suture to be specific. Okay. So this is the second type of suture, which is called as serrated suture. Now, if you remember serrated, I'll cover denticulate here itself. Denticulate means nothing. It is sawtooth. So just if you have serrations, make them bigger and make them like sawtooth, multiple sawtooth, right? If you have multiple of these sawtooth appearance, they both will join together and form something called as a denticulate suture. Now, where will you find this? Again, you will find this in the skull also. Now see this. See this? This particular suture? See, this is like a sawtooth, right? Multiple. And this particular suture is called as a lambdoid suture. Like you can see a lambda. Have you seen a lambda, right? A lambda is a symbol. Because the symbol is formed because of the suture, it is given the name as simple lambdoid suture of skull. So how to remember it? First, I dealt with plain sutures, two bones joining together in the center, single suture that is plain, immobile, where it is seen interpalatine. That is over your hard palate here. Then I told you about two serration type of sutures. One suture is serrated, where it has got the zigzag pattern and it is seen over on the sagittal part of the skull, called as sagittal suture. Third is again this particular suture which is having sawtooth appearance, joining two bones together. Suppose this is parietal bone, this is occipital bone, they both are joining by this lambdoid suture. You see this? This is a lambdoid suture, like a sawtooth. Correct. So lambdoid suture is again an example of denticulate suture. So see this? I told you this is serrated. And if you do this zigzag more, like a sawtooth, see, more and more zigzag, it becomes denticulate. So remember serrated and denticulate together, because both examples are in your skull. Denticulate, lambdoid suture; serrated, sagittal suture; plain, interpalatine suture. Simple. Okay? Right. Now I'll move on to the fourth variety. This is called as squamous suture. Squamous literally means flat. Remember that. So wherever this particular suture will be present, it will be over flat bones or flat surfaces. Now, which particular bone in over our skull is flat? So you have a name of a squamous suture with a squamous bone. So this bone here, this is your squamous part of temporal bone. I'll show you that. See this bone. See this bone. This is your squamous part of temporal bone. That is why the suture is also given the name as squamous suture. See this? This is your squamous temporal bone. This is your temporal bone. If this suture is present between your squamous part and this is your parietal part, see the suture nicely getting formed and it is very plain, right? This is between two plain bones. That is why it has been given the name as squamous, means plain. Got the idea? So squamous type of sutures, examples are squamoparietal suture, which occurs between squamous temporal bone as well as the parietal bone. This is called as squamoparietal suture. So squamoparietal suture, which is again what kind of a part of suture? It is a squamous type of suture. Got the idea? Fine. Right. So now we know 4 kinds of sutures. Now I'm going to tell you what exactly the MCQ has come in your examinations. Very, very, very hit question. What is that MCQ? What is shin dialysis? Shin dialysis is nothing. It is something where you have got something like a socket and you have a key. If that key fits into that socket, that particular arrangement is called as shin dialysis. Remember like this. Now, where do you find this key and socket type of an arrangement? You have a very important bone which is just present behind your nose. That particular bone has been given the name as vomer. So see this? This is particularly a lock and it fits into a socket. So you see this kind of a bone. This bone looks like a V. So you can remember this bone as vomer because it looks like a V. And there is something called as a sphenoid bone, which has a part which projects down. That's called as a rostrum. Rostrum means a projection. So that projection fits into this vomer. And you can see this particular socket type of a joint. Don't call it a socket. I'm just telling you because ball and socket is a different variety. This is just like a lock and key. One particular bone fits into the other bone, right? This particular arrangement is given the name as shin dialysis. So if I ask you, what is an example of shin dialysis? Your straight away answer should come vomer and rostrum of sphenoid association, or wherever they get attached to each other. That is an example of shin dialysis. Again, not to confuse you, I started off with functional classification where I gave you the mnemonic SAD, synarthrosis, amphiarthrosis, diarthrosis, according to the mobility of joint. Then I went into, again, what exactly is the structure? Structure, I told you mnemonic CSF, cartilaginous, synovial, fibrous. In fibrous, I went into different varieties. And what varieties I gave you? Again, 3. Sutures, syndesmosis, gomphosis. And in sutures, I gave you 5 variety of sutures: plain, serrate, squamous, denticulate, and shin dialysis. And I showed you each and every example, how do they look. Okay, so just to have a recap of sutures: plain sutures, 2 bones, 1 single line, correct? Squamous suture, again, it is a type of plain suture, but it has a little angle over 2 plain surfaces. That's why it's a squamous suture. Serrated means having zigzag serrations. Denticulate means sawtooth. Examples are what? If you have a plain suture, interpalatine. If you have a denticulate suture, you remember this lambdoid arrangement or lambdoid suture. I told you about serrated sutures, which comes in the center of the skull. That is called as sagittal suture. And finally, in the end, you have got this kind of an arrangement where one bone fits into the other bone. And this is called as shindylisis, which is mostly formed between vomer as well as rostrum of sphenoid. Okay. Now I showed you one more suture between two plain bones. That is nothing between the parietal bone and the squamous bone. So we give it a name as squamoparietal suture. Simple as that. Right? So now you understood what exactly these sutures are. And I told you why sutures we call them, because they are sutra, they are sewed together. And now you understand, right, that sutures are why called as synarthrosis. Can you move this? No. That is why sutures, when I talk about sutures in a structural classification, they are called sutures. When I call sutures in functional classification, I would call them synarthrosis. Now you're understanding the concept, what exactly these terminologies are, right? Okay. Now I move on to the second type of our fibrous variety of joint. Okay, I'm still in fibrous. So I told you 3 varieties. Second type of fibrous joints are called as syndesmosis. Now, what do you understand by this particular term? Syn means again together. Desmosis means a union. 2 bones getting united together. But what exactly is the difference between a suture and a syndesmosis? In suture, there are 2 bones coming together. Here, in between the 2 bones, you will have a strong membrane or a ligament which connects them. This is the difference between suture and syndesmosis. So wherever 2 bones are connected by a membrane or a ligament, that particular structure will be given a name as syndesmosis. Now let me give you an example. Okay, let me give you a very simple example. Let's suppose this is again your leg. Okay, your leg has got 2 important bones. That is what? You have got your tibia, you have got your fibula. These are 2 important bones of the leg. Similarly, you have got 2 important bones in the forearm. That is your ulna and your radius. Okay, radius is again towards the thumb side. Ulna is towards the other side, towards your little finger. Now, these 2 bones are joined together in between. Okay, just see this. In between, they have got a membrane. And this membrane is given the name as interosseous membrane. Inter means between, 2 bones, osseous, interosseous membrane. Similarly, that interosseous membrane is also found between your radius and ulna. Correct. So what will interosseous membrane be? It will be a type of syndesmosis. Why? Because it is connecting 2 important bones. Are you getting the idea? So a type of fibrous joints which connects by the help of a strong membrane or a ligament is given the name as syndesmosis. Examples: interosseous membrane, which is found in between tibia and fibula. Also, it can be between your radius and ulna, right? As well as you can see this. This is a type of membrane which is between your 2 bones at the distal end of your tibia and fibula. See this? This is forming a joint here. And what exactly it is giving? What exactly is the function of this particular thing? Now, just see here my hand, okay? If my bones are not joined together, I won't be able to move my joint like this and this. See this? My one bone is almost twisting over the other bone. So if I have a membrane in between connecting them, I would be able to easily do this function. And what is this function called as? Pronation and supination. Correct? So this interosseous membrane is a very important structure for pronating and supinating any particular structure. And where we do this commonly? Over in our legs as well as over in our forearms, because these are the most common areas for pronation and supination. Correct? Another important point, another important example of this particular syndesmosis is talofibular joint. Okay, so here is your bone called as a talus, and here is your fibula. So you have got a connection between them. That is also a type of syndesmosis. That's called as a talofibular joint. And the last example of this syndesmosis variety is ligamentum flavum. Now, what is this ligamentum flavum? See this. This is your spine, right? Right? And this particular area is the body, right? This is the body. And then behind that vertebra, you can see this particular area, which is just bridging these processes in between. This process is being bridged by a ligament, and that is called as ligament flavum. Just simply, if this is my vertebra, the posterior side of this vertebra has got a ligament. And that ligament is called as ligamentum flavum. What example is this? It is a type of syndesmosis because it is bridging two bones with the help of a ligament. So if I just ask you, just mention me one particular example of syndesmosis where two bones are bridged by a membrane, you can tell me interosseous membrane between your radius and ulna, between your tibia and fibula. But if I ask you, name me a syndesmosis where two bones are bridged by a ligament, not a membrane, you can say, or you can give me an example of ligamentum flavum. And this is nothing but between the two vertebrae, this is a thin sheet of ligament which connects two vertebrae from posterior side. That's called as ligamentum flavum. Got the idea? So now you understand what is the difference between what is suture and what is syndesmosis. Still, I am on fibrous joints. Okay, I told you there are three types. Sutures completed, syndesmosis done. Now we'll move on to the third variety of them, which is given the name as gomphosis. Now, what do you mean by a gomphosis? Gomphosis means nothing. It is just, remember, a tooth socket. Remember tooth socket. If suppose anywhere you see this gomphosis coming in, tooth socket is the only and the best example for this particular joint. You have a socket, a tooth fits into it. This variety of joint is given the name as gomphosis. Okay, so this has been multiple times asked, and I'll give you clinical scenarios so you'll understand more. So this is also a type of fibrous joint, and it is immovable. That's why you cannot move your teeth over your alveolus. So gums are given the name as alveolus. Okay, so you should use now these anatomical terms. So you shouldn't call it gums, you should call it lower alveolus, upper alveolus. Okay, so these teeth fit inside this alveolus or the alveolar bone by this kind of a socket arrangement, and this particular arrangement is given the name as a gomphosis joint, or also given the name as a tooth and socket joint. Okay, so this is a classical example of gomphosis. Now I finally complete again the fibrous part of our joints. So I told you three varieties. I've told you about sutures in fibrous joint. I told you about syndesmosis. I told you about gomphosis. And I told you various types of sutures. I told you various types of syndesmosis. And I told you what is an example of gomphosis, where your teeth fits into that socket. Correct? Fine. Now I finally leave my fibrous joints. I move on to the second variety of joints, that is the cartilaginous joints. So I already told you, remember my mnemonic CSF, right? So I've completed the F part, that is fibrous. C is cartilaginous. Okay, so I know we are not covering today. So cartilaginous as well as fibrous. Fibrous completed. Now we move on to the cartilaginous part. Cartilaginous joints can again be classified into two varieties, two simple varieties. Very, very important question, very, very important and hit answers in your vivas. Okay, cartilaginous joints are again of two types. They can be primary cartilaginous or they can be secondary cartilaginous. So I'll tell you what exactly you mean by primary cartilaginous and secondary cartilaginous. Now, primary cartilaginous joints, very, very, very important. Write it out. They are also given the name as synchondrosis. As I told you, synarthrosis is a union between two bones. Synchondrosis is a union between two cartilages. Okay, so this particular variety of a joint is given the name as synchondrosis. Okay, now what exactly you mean by synchondrosis? Just see this particular diagram, and I'm going to just tell all the concepts here itself. Synchondrosis is also called as primary cartilaginous joint. This is a type of immovable joint, and it is a temporary joint. So now what exactly you mean by this term? Synchondrosis or primary cartilaginous joints mean that if there is a bone on one side and if there is a bone on the other side, between the two bones, there is a small gap that is bridged by hyaline cartilage. Now, if you remember my last lecture on bone, I told you each and every detail how this hyaline cartilage is related to a bone and where all you find this hyaline cartilage in the bone, right? And I told you even a very important part of hyaline cartilage, that hyaline cartilage has a tendency to ossify. That means if you leave hyaline cartilage, it will tend to become a bone later on. It will ossify. So what exactly is synchondrosis? Synchondrosis, that is why it is called as temporary, because temporarily, for some amount of time in our life, we have hyaline cartilage in some areas of our bones between bridging the gap between two bones. And then later on, this hyaline cartilage ossifies and converts itself into a bone. That is why it is called as a temporary joint, because later on it is ossifying into something. That is why we call primary cartilaginous joints as immovable temporary joints, because they are forming bone later on. Correct? Because the hyaline cartilage is ossifying after some time. Now, just remember something I told you in my last lecture on bone, and I told you we grow from where? There is a part in our bone which makes us grow. And that growing end of the bone is basically the epiphysis, right? If you remember my last lecture, that epiphysis is connected to our diaphysis with a very important plate. And this is called as an epiphyseal plate. Now, what do you mean by an epiphyseal plate? I told you. Epiphyseal plate is a very rich zone of hyaline cartilage. That means if this is my epiphysis or the head of my bone, and this is my diaphysis or the shaft of my bone, in between that, there is a very thin line of hyaline cartilage. And this hyaline cartilage is extremely helpful to us. Why? Because once we are born, we have got this epiphyseal plate ready. Now, this epiphyseal plate has hyaline cartilage. Hyaline cartilage will have got immature chondrocytes, or chondrocytes, let's say cartilage forming cells. So what will happen? These cartilage forming cells will keep multiplying, and it will cause the elongation of the bone in a longitudinal axis or in a straight axis. That means if my bone, let's suppose this is my marker, right? This is my epiphysis. This is my diaphysis. My epiphyseal plate is this black bridge. Okay. So what will happen? This epiphyseal plate will keep on growing. And finally, my length of my bone will be achieved. And now I am 6 feet tall. Now it will finally ossify and my primary cartilaginous joint is done. It has finished its function. You understood? So finally, this hyaline cartilage will ossify. Remember that. That is why it is called as synchondrosis, because the cartilage is bridging two bones. It is causing a union between two bones. That is why it is given the name as synchondrosis. Okay. So one example of synchondrosis is what? It is again epiphyseal plate of long bones. So let's say long bones of femur, humerus, tibia, fibula. They are all long bones. All these have got epiphyseal plate at both the ends. That is why we keep growing. And finally, once we reach 25 years of age, our bones stop growing and this ossifies. Otherwise, we'll keep on growing till life and we'll be 12, 13 feet. But it has to stop sometime, right? Correct? Okay. Now, the second part or the second type of this particular variety of joint is our first chondrosternal joint. Remember this. You have to memorize this part, but it has got a very important MCQ that is there with it. So what do you mean by a chondrosternal joint? Sternum is our nothing. It is our bone that is present in the center of our chest or our thorax. That is called as sternum. So see the sternum, right? Now our ribs are attached to the sternum, correct? So the first rib, where it attaches to the sternum, it has a hyaline cartilage in the center. You see this? This is the first rib. This is the sternum. Here is the hyaline cartilage. That is why our first chondrosternal joint is again what variety of joint? It is a synchondrosis, because later on in life, this particular hyaline cartilage will ossify and it will stop growing its length. That's all. You understood? Right? So I've completed what exactly you mean by primary cartilaginous joints. I've also completed what do you mean by the term synchondrosis. So these are immobile joints. They are temporary joints as well as where hyaline cartilage will ossify after some point of life. And examples are first chondrosternal joint as well as the epiphyseal plate. Fine? Okay? Right. Now I move on to the second category of cartilaginous joints. So I told you there are two categories. One type of category I have already told you, that is synchondrosis or primary cartilaginous joints. Second type of category of cartilaginous joints is secondary cartilaginous joints. Now there is a very important term given to it. Symphysis. Sym means together, physis means growth. So symphysis means if two bones are attaching to each other and growing, that particular thing is given the name as secondary cartilaginous joint. Got the idea, right? So what do you mean by secondary cartilaginous joint? Now, how do these differ from our primary cartilaginous joints? In primary cartilaginous joint, I told you these are temporary joints. That means the hyaline cartilage will ossify itself later on in time. But here there is a hyaline cartilage which is present and it is permanent. You're getting it? So here there is nothing called as ossification of the hyaline cartilage later on in life, and it is fusing and it is a temporary joint. These are ready-made joints which have a hyaline cartilage in between them. And that hyaline cartilage is going to stay for life. It is not going to go away. That is going to stay for life. This is the difference between primary cartilaginous joints and secondary cartilaginous joints. So if I say primary, they are temporary. Secondary, they are permanent. Primary, they are immobile. Secondary, they are slightly mobile. Primary, again, hyaline cartilage ossifies with time. Secondary, hyaline cartilage is present and it will persist. There's no ossification that goes on in these particular joints. Correct? Now, what are the types of these secondary cartilaginous joints, or also given the name as symphysis? Now, I'm going to show you some pictures. Okay? Very, very important and very, very easy structure that we know in our hip bone is given the name as symphysis itself, and that is called as pubic symphysis. So pubic symphysis means what? Pubis is particular this area, two particular fusion of this particular side of the hip bone, this particular side of the hip bone is occurring in the midline, and this particular structure is given the name as pubic symphysis. Now, simple pubic symphysis, you can see this hyaline cartilage which is not ossifying and it is persisting. So this is a permanent joint. Definitely, you can move this joint. It is lightly mobile, not fully, right? Why it is lightly mobile? Just think, because this particular area is the area for childbirth. Suppose if the womb or the mother, whenever the mother is delivering, the child is somewhere here, right? In the pelvis, above the pelvis, the uterus is here. Now, once that child will come out of that inlet through the vaginal canal, what particular thing will expand? These hip bones have to expand. And because hip bones have to expand, they need something in between which can make them expand. And this will help them expand. This particular area, that cartilaginous disc that is present, made of hyaline cartilage. And that is why pubic symphysis is important. Right? Okay, that is why I told you it is a permanent, lightly mobile joint. Right? Okay. Now we come to another variety of joint. This I have already told you. Now, if you remember intervertebral disc, where did I take that name? If you remember the functional classification, I took three important terms: synarthrosis, amphiarthrosis, diarthrosis. Now, amphiarthrosis was what? Lightly mobile joint. Now you understand. So that is the reason, that is why it is given in functional classification. But according to structural classification, these are secondary cartilaginous joints, or we can also call them symphysis. Now you're understanding how you can correlate between these two classifications. Otherwise, you cannot mug them up. It's too difficult to understand if you just start reading and mugging them up. So intervertebral disc is like a cushion between these two vertebrae, and that cushion is made up of hyaline cartilage. And that is the reason this particular cushion helps that spine to move in various directions. It is lightly mobile and it is persistent. If this intervertebral disc will not be there, this particular bone and this particular bone will start rubbing. And what we give the name as arthritis. When two bones rub together and cause each other's inflammation, that is given the name as arthritis. So we have a cushion here, and that is formed by the intervertebral disc, which is a type of secondary cartilaginous joint, or we can also call it is a type of symphysial joint. Got the idea? Fine. Okay. Now we have got another variety of joint, which is basically, so if you just read this, they are slightly mobile, they are permanent, and you have got a hyaline cartilage which is bridging between them, and that is permanent. So I've already told you pubic symphysis and intervertebral disc. One example also I'll tell you, that is in between your sternum, or basically that is something called as a manubriosternal joint. Now, what exactly is manubriosternum joint? Manubrium of the sternum is the upper part of sternum. Okay, this is the shield. You see this is the rib cage. This particular part of the sternum is given the name as manubrium. Now, the rest of the sternum with this manubrium, you see this particular joint. This is given the name as manubriosternal joint. And this particular joint is also a type of this variety, of symphysial variety, or a secondary cartilaginous joints. Got the idea? Why? Why you have been given that? Why it is being given here? Is because if you are, suppose, inhaling, right? Ribcage is moving out. Correct. So this particular structure is also moving out like this. That is the reason you have been given for light mobility. But they have to be permanently there. If they ossify, this mobility will be gone. And I'm going to show you some clinical scenarios later on how you can actually correlate this in real life. Okay. So this particular thing is the difference between primary cartilaginous joints and secondary cartilaginous joints. So today I've kept it simple. so that you don't confuse joints and you don't confuse between different types of variety of joints. Synovial variety of joints, we are going to take a separate segment because there are a lot of things inside it. Otherwise, it would all be a hodgepodge. That's why we have segregated our whole topic that way. Okay. So what I have done, again, a recap or a revision. I have told you a joint is a union between two bones, correct? In that joint, I've told you two classification systems: functional variety, structural variety. Functional, mnemonic, SAD. Again, synarthrosis, amphiarthrosis, diarthrosis. Synarthrosis, not mobile. Amphiarthrosis, lightly mobile. Diarthrosis, freely mobile. Got it? Then I told you a second classification according to the structure. I went into CSF, C, S, and F, cartilaginous joints, synovial joints, fibrous joints. Fibrous joints, again, I told you three varieties. What were those? Sutures, syndesmosis, gomphosis. Then I told you different type of sutures, which were 5 categories, right? Then I told you what syndesmosis is, and I showed you what examples, which are nothing but bridging membranes and ligaments. But then I told you about gomphosis, remember the teeth. Gomphosis, teeth, right? This particular thing finishes your fibrous variety. Then I went into cartilaginous variety. Cartilaginous type of joints are again 2 categories: primary cartilaginous, secondary cartilaginous. Primary cartilaginous are nothing, they are temporary, where hyaline cartilage is present in between them. They are called as synchondrosis. If that hyaline cartilage ossifies later on, that bone will stop growing. That is seen in where? In our epiphyseal plate, correct? And our first chondrosternal joint. This is what the part we read in primary cartilaginous. And then I came to secondary cartilaginous, which are our permanent joints, which are bridged by a fibrocartilage, which is nothing but hyaline cartilage. And that does not ossify, and it is present in our important areas like pubic symphysis, intervertebral disc, as well as our manubriosternal joint. Got the idea? This is how simple you have to make anatomy, so that you can remember these things easily and you have to see a lot of things. Now I'm going to take you through very interesting clinical scenarios, and I'm going to start my word round. So I would like Aishwarya to come in.
Sure, sir.
Yeah. So Aishwarya, so I would like the students to participate in it. I've got really interesting case scenarios and how this really applies to your clinical knowledge. So I'm going to start straight away, and I want the students to participate. Okay?
I'll make sure, sir. No worries.
Right. Okay. So let's move on to the first type of a question. Now, this is what you will be getting. Okay. This is why I'm trying to get that thought inside you. There's gone other days where we used to get these straight away questions, but now you have to start thinking in clinical setups. So a newborn child was noticed to have an asymmetrical head. He was diagnosed with something called as craniosynostosis. Now, to make things simple for you, craniosynostosis is something where our fusion between the two parts of the skull occurs much early in life. So there are things here, right? So the joining between two, or the fusion in between two skull bones, happens too early in life. That is why when our brain is growing, it doesn't have space to grow. And that is why you have got an asymmetrical head like this. So immature fusion of the skull bones is called as craniosynostosis. And he was advised a surgical correction to correct this. Now, can anyone identify, as per the structural and functional classification, which particular joint I am talking about?
Okay, we have our first answer from Vinayak, fibrous.
So, I want a specific answer. What do you think on the structure? What do you think on the basis of function?
Yeah, I was
very basic. That is what I want to know.
Yes, if you guys can specify what structural and what functional.
And what is the function?
Yes. So we have.
Okay, we have got multiple answers.
Yes, we have got a lot of answers.
So I think the major answer is towards sutures.
Yeah, right? Most of them, sir.
Right, and somebody has answered about a fibrous suture. So let's say it's a fibrous. Fibrous is nothing, but it is a structural classification under which sutures come. Correct. And if you go by the functional classification, it will become a synarthrosis. So that is how you connect it. See, so this is an immature fusion. So correct, everybody. I'm so happy that you guys have understood now. Right. So this is how you have to classify joints. You have to start thinking that way. So if you see one bone here, you see there is nothing, there's no gap left, and they are immaturely fusing with each other. So let's say this suture is there, this is getting inside. So this is called a synarthrosis. That means it is not making anything mobile. This is on the basis of, again, function. But then I take about the structure. This is the type of fibrous. Fibrous also, it comes as sutures. Now, can anyone tell me under what type of suture will this particular suture come? What particular suture? This particular suture is an example of what type of suture? I've told you 5 varieties of sutures. What is this variety of suture in between? In between two parietal bones.
We have got multiple answers here also.
Okay.
Vivek answered plain.
Okay.
Wahid answered serrate. Muskan has answered sagittal.
Great. So sagittal suture or serrated suture, it is all going to be serrated suture is the answer, but sagittal suture is an example of serrated suture. So if I ask you which is the suture, you would say this is a serrated suture, and it is, if it is named in the skull, it is called as sagittal suture. That is the answer. Got the idea, right? So I'm very happy that you guys have understood this, because this has got a lot of, mugging up, and you don't understand all this stuff. Then you read line by line. Okay, let's move on to the clinical scenario number 2. Okay, so now this particular man is a 22-year-old male, came to the OPD with complaints of a non-healing socket in his right lower alveolus since 1 month. He gave a history of tooth extraction because he had some tooth caries. And can anyone identify, as per the structural classification, which type of joint I'm talking about here? I think there's...
Okay, we have Vivek who has answered as gomphosis first. Can we have Vivek
fastest
on the
finger
mic,
first
please?
going on, and whoever answers first will get the reward. Okay, so...
Yes, I think, can we have Vivek on the mic, sir?
Yeah. So I want to talk to Vivek because he has answered right.
Hello, ma'am.
Yeah, hi Vivek. So,
Hi.
Yeah, so gomphosis, can you explain me what gomphosis is?
Gomphosis is joint between tooth and the peg socket of jaw.
So it is also called as a peg and socket joint,
peg
right?
And socket.
Peg and socket, or a tooth attaching itself into the alveolus, so we can call it gomphosis. Correct. So if you have this kind of an arrangement like a non-healing kind of a socket, so you can straight away think as, oh, this is gomphosis. Now, can Vivek tell us that what is this bone literally called as?
Yes, sir.
Yeah, what is this bone, or where is this tooth present on which bone? Okay.
I think there are a lot of discussions.
So correct, it is mandible. It is the alveolus. So alveolar process of the mandible, or we can just call it alveolus or the lower alveolus. It's a part of the mandible. Correct? So don't call it gums.
Yes.
Now you have a thing where you have to talk like anatomy. Okay? So you have got a huge dictionary that you have to talk about. Okay, right. So now we have got the scenario number 2. Let's move on to scenario number 3. Okay, a 50-year-old male came to the OPD with complaints of severe lower back ache, which aggravated after lifting a very heavy bucket. Now an MRI was done, and this particular person, after an MRI, we saw this particular thing that the intervertebral disc has a prolapse with significant amount of herniation that is compressing our spinal cord. Right. So this is what this particular man was having with a herniation. Now, can anyone tell me, as per the structural and functional classification, which particular type is this herniated disc? What will this herniated disc by functional, and what is the structural?
Okay, we have Vivek again answering first as secondary cartilaginous. After that, we have Sai Vigneswar, secondary cartilaginous joint. Then Vinayak saying the same answer. Muskan saying symphysis. Gayatri saying
fibrous. So symphysis and secondary cartilaginous is both the same. So it's the right answer. Can anyone tell me what exactly is the functional classification? Yeah. So I think everybody has answered well. So
yes.
Right. So can we have one person so that I can discuss this?
Can we have Sai Vigneswar this time? Since we already had a discussion with Vivek.
So this is how we revise. So first we'll revise everything off.
Hi, Sai. Hello, how are you?
Fine, ma'am. How are you?
I am also doing good. Where are you from?
I am from Usmania Medical College.
Great.
All right, yeah.
Great. Hyderabad.
Yes, yes, ma'am.
Very good. Okay. So, Sai, I just wanted to ask you, this is amphiarthrosis, correct? Can you tell me what is amphiarthrosis?
It is a slightly movable joint.
Correct. So it is a light mobile joint. It's a slightly movable joint. We give it a name as amphiarthrosis. And you have this intervertebral disc, so it is fitting into secondary cartilaginous. Now, can you tell me 2 differences between primary and secondary cartilaginous joints? I'll be very happy.
Sir, primary immovable. Secondary slightly movable. and primary are temporary joints.
Hmm.
Secondary are permanent joints.
Great, great. And second, and why are primary temporary?
The hyaline cartilage ossifies and converts into bone.
Great, great, great. So I'm very happy. So great, and 100 points to you because you've answered each and everything correctly. Okay, so this is how we can revise everything off with these scenarios. That is why we have kept these scenarios, so that you can easily revise off and you can remember this once and for all. Okay, done. Now we move on to the scenario number 4. Okay, now scenario number 4 is again tricky. Let's see how many of you actually get it. 20-year-old male came to the OPD with complaints of difficulty in breathing from the right nostril. Now this is something which is very common. He gave a history of a road traffic accident 2 months back, post which he developed a deviated nose. So now he has a deviation in the nose. And he developed difficulty in breathing because of that. Now, during the surgery, the surgeon who's operating, he noticed that this particular person has a broken vomer and a rostrum of a sphenoid. So he wanted to correct that. Now, can anyone tell me what particular variety of this structural classification is this joint between the vomer and the rostrum of sphenoid? I think answers are coming in.
Yes.
Yes. So
can I call someone, sir?
Yes, sure. I want to talk to them so that the revision is done.
Yes. So I think we can have Shraddha this time.
Okay.
Shraddha? Can we have you on the mic, dear?
Hello.
Yes. Hi, Shraddha.
Hi, Shraddha.
Hello, sir. Hello, ma'am.
Yes. Where are you from?
I'm from Nagpur.
Okay. So you're studying in Nagpur?
Yes, GMC Nagpur.
Great. Okay. So right answer. Congratulations to you. It is shin dialysis. But can you tell me what exactly in shin dialysis, what is where exactly it comes? Like what type of a joint is shin dialysis?
It is a fibrous type of joint.
Correct.
Where the two surfaces, one is the.
So one bone fits into the other bone like a socket. Correct.
Yes.
That is what shin dialysis is. So it comes under sutures. Okay.
Yes.
Fibrous, suture, shin dialysis. Correct.
Yes.
Now I'll give you 100 points if you just tell me the 5 types of sutures that I told you, because here itself you'll remember for life.
5 types of sutures are plain,
correct,
serrate, squamous, denticulate, and shin dialysis.
Great. Now, if your anatomy professor is asking you questions, you raise your hand and you tell confidently that I know this answer. Okay, right. Great. So congratulations. It's absolutely right. I'm so happy that, you guys are answering so well. So there's a great batch of students and I'm very happy that so many people are answering. Unfortunately, we can't call so many people. We're calling one randomly.
I actually want to acknowledge their name by at least calling them.
But I'm very happy. See, this is what exactly learning is all about. Anatomy is not supposed to be just read through textbooks and start mugging it up. You have to be interactive. You have to, clear your doubts here itself, and you have to then finally understand it. Right? Okay. Now we move on without waiting to our 5th scenario. Now, if you guys remember, I did something. I showed you something. In order to perform this particular function, which variety of joint we are going to utilize structurally? Think.
Okay. We have Vinayak.
So I think Vinayak has already gone to the part which we are going to discuss later on in synovial variety.
And Sai Vigneshwar has answered syndesmosis.
Okay. So I think many people have answered after that.
Yes.
Right?
I think
can we have any one of them?
Yeah, we can have Komal on the mic, please.
So saddle joint, I'm going to come. Don't worry. We have got a huge range of motion that we are going to discuss. Hinge, saddle, pivot, what do all they mean in synovial variety. So wait on for the next segment. But here I've covered about 2 categories of joints. So who is there on the mic?
Komal is there.
Sir.
Okay. Yeah. Hi, Komal. Where are you from?
Sir, I am from GMC Nagpur.
Great. So we have again Komal from Nagpur. So Komal, can you tell me what exactly is that particular thing that is present in between 2 bones?
Sir, interosseous ligament is present, which make the joint between them And syndesmosis is a fibrous type of joint.
Correct. So it is a fibrous type of joint. You can say it is an interosseous membrane. Okay. Instead of calling it a
Okay,
ligament.
sir.
Can you tell me one more example of this particular syndesmosis? Anyone?
Sacroiliac joint is again one example.
Okay. That is something that is from your side. I'm very happy that she has got one more joint. Okay, that is also an example of it. Right. Then can you tell me one more?
Sorry, sir, I forget.
No problem. Can anyone else tell me? No issues? You have told me a new thing. Okay, that is also a correct answer.
We
Okay.
have some of them answering, sir.
Yes, sir.
Yes,
Vivek says ligamentum flava.
correct.
And
That is the right
Vahini-
answer. Ligamentum flavum is also this kind of a joint. Then
Vahini says talofibular.
talofibular. Correct. So we have got all the four answers, right? So we have got all the four answers here on the table. This is what syndesmosis is all about. It's either a ligament or a membrane which is bridging in between two bones. Simple. That's called as syndesmosis. Okay. So done. Scenario number 5. We'll move on to scenario number 6. Okay. A 12-year-old male came to the OPD with complaints of severe pain in the right lower arm since 2 hours post a history of fall. Okay. So to be specific, this is a forearm. Okay. Right lower forearm. X-ray was done and it confirmed a fracture involving the lower aspect of the radius. Now, the term lower aspect of the radius. And you can see that particular fracture also, which is running here. Right? You can see this particular structure. And you can see the whole fracture line is coming through something. Now, the doctor advised this particular patient for surgical plating as well as a screw or to immobilize this. And he explained that patient about a certain thing that is important for growing, the important aspect about this particular area for growth. And he said that in the growing years, you will have problem. Now, can anyone identify as per the structural classification, which type of joint is affected here? Telling about structural, okay? Think.
So we have Vivek saying
So-
radio-ulnar joint.
So it's over the radius. The fracture is running solely over the radius, and you can see that the fracture is cutting through something. See, it's cutting through something.
Yes.
So if suppose you think and go back, I told you the growing end of the bones, they have got, correct. I think now people are understanding, right?
Yes.
We have got answers?
We have first Muskan saying primary cartilaginous joint.
Correct.
Srivani primary cartilaginous, and we have
Correct.
someone saying epiphyseal plate.
Very good. So to be
then-
specific, this is a type of primary cartilaginous joint. And under that example it is an epiphyseal plate. Now,
Yeah,
can I have someone?
Yeah, can we have Muskan on the mic, please? I hope that's how I pronounce your name.
Yeah.
I'm sorry if it's not that way. Hello, may I know how to pronounce your name, dear?
Correct.
It's correct. Okay. Hi, Muskan. How are you?
I'm fine.
Yeah.
Hello. The voice is not very clear. Can you just make sure you're a little more
Okay.
louder?
Is it audible?
Yes, it is audible now. Tell me your answer, dear.
It is primary cartilaginous joint.
Correct.
Okay. Over to you, sir.
And it is an epiphyseal plate, correct?
Yes,
It's a
it's
type
an
of primary
epiphyseal.
cartilaginous joint. Now, can you tell me what is a primary cartilaginous joint?
It is a type of it is a structural classification where there is a hyaline cartilage is present. It is a temporary joint which get ossified after a few years.
Great.
And it is
the hyaline cartilage
immovable.
which gets ossified later on in life and it gives that growth segment. Finished.
Yes.
Great answer. I'm very happy that you've understood. Congratulations. That's absolutely right. Right?
Thank you, sir.
Now we move on to the 7th scenario. Okay, this is also something which is very interesting. A 62-year-old man came to the emergency with severe chest pain and palpitations. Now his angiogram was done and it revealed a triple vessel disease. That means that all 3 heart vessels were blocked. And the patient was planned for cardiopulmonary bypass surgery. Now this is again a trick question. Okay. Now, during the surgery, the sternum was split in the midline for exposure of heart and vessels. So you see here, this is the sternum. Now he has split the sternum in between so that he can get the whole thing or a whole view like this, okay, of the heart and the great vessels. Now, can anyone identify as per the structural classification which particular joint is cut through the sternum and what variety it is? Anyone?
Okay, we have Sai Vignesh answering secondary cartilaginous.
Okay.
Pratha.
So can anyone come and tell me exactly what exactly you are thinking of? Can we discuss this?
Can we call Vahini, sir? Vahini, can we have you on the mic? Hello?
Yeah. Yes, Vahini. Where are you from?
Can you unmute yourself, dear? Okay, no problem. Sir, she's outside. So
okay, no problem. Anyone else?
Someone else. Anyone else who wants to answer?
I would be very happy because I want to actually clear off all doubts here itself in this diagram.
We'll go for Sai Vigneshwar itself then.
Okay. Anyone.
Sai, Muskan, Komal, Vivek,
Anyone.
Vahini or Shraddha. Anyone can answer.
Let's discuss what is cardiopulmonary bypass.
Yeah, I think Sai is there. Sai?
Okay.
Hi, Sai.
Hi, ma'am.
Yes, Sai.
Yeah.
So, first you tell me what is exactly what you think of?
It's a joint between manubrium and sternum, sir. We have to cut the joint.
So this is a manubriosternal joint, right? And what is the type of joint of manubriosternal joint?
It's a secondary cartilaginous joint.
Secondary cartilaginous joint. Absolutely correct. What do you mean by secondary cartilaginous joint?
Is permanent and slightly mobile joint.
Right. And what is the other type or the other example of this particular joint?
It's intervertebral disc and
Right.
pubic symphysis.
Great. We also call them as symphysis. Right?
Yes.
Got the answer. Great. Very, very happy. Okay. So this is how clinical scenarios are given. So you don't get disheartened by just seeing, oh my God, this is something like a cardiopulmonary bypass that is out of my syllabus. It is all in your syllabus. Whatever you're reading today is going to help you tomorrow. Remember this line. Okay, they are all connected. There's nothing as these connections are not there. And that is why the CBME concept has come up. Okay, fine. So now we'll move on to the next scenario. This is more or less connected, but this has got a catch. And I'm going to tell you the catch later on. Okay. So a 32-year-old male came to the emergency with severe chest pain and difficulty in breathing post a history of fall injury over the chest. Okay, he had a history of fall over the chest. Now, his clinical examination and the X-ray revealed that there are multiple sternochondral fractures. And there is something called as a flail chest. Now, what is a flail chest? Flail chest is nothing when you have got these broken ribs, right? That whole segment of our chest sinks inside. It just goes inside, right? So that's called as a flail chest, just like a flapper. It goes inside. That's called as a flail chest. So for that, the person or the operating surgeon did a surgical stabilization, and you can see he had done a surgical stabilization over multiple segments of this sternochondral junction. Now, can anyone identify as per the structural classification which type of joints are sternochondral joints? Again, what type of joint is sternochondral joint? Now you tell me. Simple.
We have Shraddha who has answered first as primary cartilaginous joint.
Okay.
Vivek has answered as secondary cartilaginous joint.
Okay. That is why this is a trick question. That is why I've kept it. Okay.
Vahini has answered primary cartilaginous joint, contrasternal joint. And yeah, there are mixed answers, so both primary and secondary.
So here itself, I'll tell you, write it down in your copies. First sternochondral joint is an example of primary cartilaginous joint. First sternochondral joint, as we have already discussed. Only the first. It has got a hyaline cartilage, which later on ossifies. It is a type of primary cartilaginous joint. But all other sternochondral joints are examples of plain synovial joints. So I've just kept it so that you remember this, because we have already dealt with the first part. We are again going to come for this in our synovial joint variety. But I wanted to discuss this here itself so that this MCQ is not missed out from you all. First sternochondral joint, always remember which variety? Primary cartilaginous. All the other, wherever all the other, except for the first rib, wherever all the other ribs are attaching to the sternum, those particular joints are plain synovial variety of joints. Okay, they are plain synovial variety. I'm going to tell you later on when we discuss about synovial, what is plain synovial. But just remember, this is an exception. First sternochondral is an exception for primary cartilaginous. Okay, fine. So that is why I kept it, because this is a very, very hit MCQ in your NEET exams. And till now they have been asked multiple times. So they might ask this in your home exams also. Okay, fine. Now I'm going to confuse you with my last scenario of today. And this is again to confuse you. This I have not told till now, but I'm going to tell you. That is why I've kept that way. So can anyone tell me what is the structural and functional classification of the joint, what is called as a Ziffy-sternal joint? So there's something at the lower end of the sternum. This is called as xiphoid process. And this particular joint between the sternum and the xiphoid is called as Ziffy-sternum. Can anyone tell me what is the variety of joint here, structurally and functionally?
Shraddha
Anyone?
has answered primary cartilaginous joint. Komal also joins hands with her.
Okay.
Anyone else?
Who has answered primary cartilaginous or six or?
Shraddha has answered first.
Okay, fine.
Then
So
Komal,
can we have Shraddha?
Vivek. Shraddha, can we have you on the mic too? Hi, Shraddha.
Hello.
Yeah, hi,
Okay, let's
Shraddha.
answer.
Hello, sir.
Yeah, where are you from?
I'm from GMC Nagpur.
Very
She
nice.
already, yeah.
Oh, you answered already, yes.
It's the same, yeah.
Okay.
Yes,
So
sir.
there are so many students, so that's why I get confused with names. I'm very poor with names. Yes. So, okay. So you have answered what variety?
Primary cartilaginous joint.
Primary cartilaginous joint is also called as?
Synchondrosis.
Great, synchondrosis. So this is a structural classification or a functional?
It is structural classification.
So structurally, xiphoid and sternum form a joint or the Ziffy-sternal joint. Structurally, it is called as synchondrosis. The catch is, functionally, this is classified as synarthrosis. Remember this line. This line is going to come 10 times to you and you are going to have MCQs on it. So this is the only joint of particular skeleton, which is something structurally, or let's call it synchondrosis or primary cartilaginous joint structurally. Functionally, it becomes synarthrosis. Now, can you tell me, Shraddha, why it is functionally synarthrosis? What is synarthrosis? In the beginning, I told you.
As there is no joint cavity between the two joints.
Not movable. Synarthrosis is not movable.
Not movable.
So that is why this thing cannot move. Okay, immovable. Yes. So one side we call it functionally. It is what? It is synarthrosis. Structurally, it is synchondrosis. Correct. And or we can call it primary cartilaginous joint that we have already discussed. Right. So now you have understood. I hope everybody has understood today, and I hope joints is no more a fear. We're going to cover the synovial part. This is again my favorite line. Don't stop, because one day you will be someone's hope and someone's hero. Whatever you are reading today is going to work for you tomorrow. I think these things are not important, or they are not going to come. Somebody will become an orthopedic surgeon, somebody will become a general surgeon, somebody will become an ENT surgeon, somebody will become a physician. Still come to you. Everything will come to you. By one part, and you will remember these days where you read it. Okay? I'll get Aishwarya in for winding up today's session. And I also want to congratulate all the students who have answered correctly. I'm really happy. There's a great batch of students which have participated, and I really want these students to do well.
Sure, sir. I must agree with you on that, because I can see a lot of names that keeps repeating, like Komal, Vivek, Sai Vigneshwar, Shraddha, Muskan, Vahini. Like, they were answering for almost every questions which we asked, and they were brilliantly answering with reasons.
I'm so happy that people are answering anatomy now. So
yeah, exactly.
This is one thing that everybody stays silent, and I'm happy that children, everybody is answering anatomy questions, and this makes them better for tomorrow.
Yeah, I was just remembering, like when I was in first year, I had a very tough time dealing with these terms, these medical terms, the new words, the syndesmosis, all those things were like very difficult for me, but they are like really, they have a very good approach to how they have to learn the subject. I am very happy to see this generation like this, and I know all these people will surely reach great heights. So before I conclude, I have one important message to all of you. We have been doing the Polaris talks every Monday, Wednesday, and Friday at 6:30 p.m. So this was the event. This was the talk which I've been doing for our first year students. So now we are expanding our talk sessions and other, the lectures or the lives to other years as well. So as a part of it, we will be trimming down our sessions of Polaris talks into 2 times a week. So we will be coming live every Mondays and Fridays from the very next week. Same time, 6:30 p.m. Okay. So keep a note on this. We'll be coming live every Mondays and Fridays sharp at 6:30 p.m. So the session will continue with general anatomy every Mondays and Fridays. In between days, we'll be coming up with other sessions. As in now, it will be informed to you as well. Okay. And second thing is, I would also like to have an opinion or rather a feedback from you regarding how today's class was. You can just let me know in the comment section. Did you guys enjoy it? Was it, really good? Did you understand? Is there anything which we have to improve from our side? Okay, please make sure you put a word in the comment box so that we can also make sure we tweak ourselves next time. So can you guys please comment? How was the session?
Feedback for me.
Yeah. So I was looking forward from all of you.
This is the only thing that keeps us going.
It's awesome from their side. So great. So I think all of you have the same opinion, and do let us know if there is anything which we can change upon in the future sessions. And also one more thing is that the drawing section is not completed. There is one more part, as sir rightly mentioned, which will be discussed on Monday. So do come back on Monday for the completion of joints, as well as the previous sessions of general anatomy is there in YouTube. Take a look at the videos in YouTube in our official channel as well. So they are giving very nice
I'm very happy.
feedback. Thank you so much for that. This keeps us move forward. So let us see you guys on next Monday, sharp at 6:30 p.m. Until then, have a great weekend and have a very nice, good night today. Bye. Thank you so much, sir. Bye-bye.